videos what I have been taking up in general surgery. So today's video I'll be mainly discussing about what is an ulcer and what is a type of an ulcer what is called as a non-healing ulcer. So in this video we'll be studying about this, what the definition of an ulcer, what is the meaning of an ulcer, and particularly I'll be mainly focusing upon the non-healing ulcer, which is also called as a chronic ulcer. So, starting with, an ulcer is defined as a breach or a break in the continuity of an epithelium of skin or mucous membrane. So, students and viewers, starting with, this is very important from this perspective, that an ulcer, it is defined as a breach or a break in the epithelium. So, during the formation of any ulcer, so if this the tissue is there and epithelium, you must be knowing in general oral anatomy or in general skin, when we look at the skin, what do we find is it is covered by an epidermis is there, and below it is the dermis. Or in case of a tissue, it is the epithelial surface is there, and below it is the connective tissue surface. So an ulcer, it is defined as a breach or a break in the epithelium. So whenever a break is going to occur in the epithelium, or this epithelium can be of skin, it can be of skin, or it can be of a mucous membrane. So such a situation, it is called as an ulcer. Now for every ulcer, what do we have is that there is a break. Since there is a break in the epithelium, so that gives rise to a beefy red appearance, and this beefy red appearance is somewhat deep and having this granulomatous tissue. This is also mostly seen. So whenever an ulcer is formed, the ulcer is can be studied into, if this is the shape of an ulcer what I have drawn. So whenever we study an ulcer, we look for the what is the floor of the ulcer is there. When we look at the structure of it, the base of the ulcer is there, as well as the edges of the ulcer is there. So, in condition of a non-healing ulcer, so today's video I'll be mainly focusing upon the non-healing ulcer. So, non-healing ulcer, it is also called as a chronic ulcer. Why? Because it has no tendency to heal by itself. So, a chronic ulcer has got no tendency to heal by itself. That's why it is called as a chronic ulcer, and sometimes it is surrounded by serosanguinous and purulent material, and which can have a foul smell as well. So there are certain non-healing ulcers. Now, what are the causes of having a non-healing ulcer? If an ulcer is present somewhere in the body and if it is non-healing, so what are the causes of having a chronic non-healing ulcer? So first important cause, if it is a chronic or a prolonged infection. So if there is any kind of a chronic infection, a long-term infection is there, and if that infection is not being controlled with medications, so that can give rise to an ulcer. The next is poor nutrition. So what do we see is, if in certain cases, if the supplements, the body is not meeting the adequate amount of nutrients what is required for the health of the skin and the mucous membranes, so that can also lead to the formation of an ulcer. So first was a chronic or prolonged infection. The next is the poor nutrition. So if it is having some body parts is having a poor nutrition, so that will give rise to a non-healing ulcer. Next is in the condition of malignancy. So malignant conditions are those conditions where the proliferation of the cells is such an abnormal proliferation is there, and which is metastasizing to different body parts. So in such a situation, it is called a malignant condition, which is the most fearful condition. So if it is a condition of malignancy also, that ulcer won't heal by itself. Next, if there is an inclusion of a foreign body, so if any foreign body is getting tucked or any foreign body gets inside the epithelium or the connective tissue, or in the mucous membrane, if it gets stuck, so in such a situation of a foreign body, being present. So this can also be an important cause of a non-healing ulcer. And last but not the least, that an ulcer can also form due to defective circulation of blood. So students and viewers, this was a very in a very short form, I have discussed about the causes of ulcer. Now, what the examples of it? Now, what do we find is that if an ulcer is present, so particularly if there is an ulcer what is formed, that is having a condition of uncontrolled sugar, so that non-healing ulcer can be, the first example is a diabetic ulcer. So diabetic ulcer, in diabetes, obviously the blood is containing excess of sugar and bacteria finds the favorable environment to grow over there. So in such a situation the immunity of the person is compromised, and that gives rise to the diabetic ulcer, which can be a non-healing ulcer if the diabetes is not controlled. Now the next is a malignant ulcer, which is having the malignant potential, which can metastasize to different parts of the body. That is in general terms it is the metastasis condition. So if it is a malignant ulcer is there, so this can also be a non-healing ulcer. Next is the carcinomatous ulcer. So there are certain ulcers which are having a localized form, so that can be a carcinomatous ulcer, can also be a non-healing. And in squamous cell carcinoma, the ulcer what is present is, that is also a non-healing ulcer. Apart from this, the last but not the least, that is in cases of rodent ulcer, we find that the ulcer is non-healing. Now we'll study about that non-healing ulcer, how it is made up of. So if it is a non-healing ulcer, the edges of the ulcer will be rounded or thickened. So this is very important. If it is a non-healing ulcer, how to diagnose it? The edges is going to be rounded or thickened. The base of the ulcer, it is indurated, it is hardened, and when we look at the floor of the ulcer, it is consisting of unhealthy granulation tissue. So viewers, at the base of, if the floor of the ulcer is examined, the unhealthy granulation tissue is necessarily present over there. Now, sometimes the non-healing ulcer may get infected and they can extend deep into the bone, leading to the infection of the bacteria in the bone. So in such a situation, that ulcer is to be treated just by the proper medications, the proper antibiotics. So if the ulcer is not treated at the initial stages, the infection might proceed into the bone. So leading to the bacteria is going to infiltrate into the bone, and if at that level also, if it is not getting treated, it is not being treated, so even the infection can spread into the bloodstream. Now when we look at the treatment, so ulcer won't heal unless infection is treated, and so treatment of the ulcer is done with the help of antibiotics, as well as, and it can also be, doctors also recommend for the surgery if it is not treated, and sometimes it can spread to the blood. So this was very important, the method to how to manage it, either it's a combination of antibiotics or and surgery, or simply antibiotics can heal an ulcer. Now when we look at the treatment of an ulcer, so first important step in treatment of an ulcer, it is the wound cleaning or debridement. So wound cleaning is done if anywhere an ulcer has been formed. So that first step of treatment of that ulcer is that wound cleaning should be done, and the debridement of the necrotic tissue should be done. So wound cleaning is done, then the necrotic debridement is there, and after that we start the antibiotics for the treating the underlying cause of infection. And if the case is a diabetic ulcer, so diabetic ulcer, the patient becomes immunocompromised due to high blood sugar levels. So if it is the case of a diabetic ulcer or in case of a diabetic foot, if that ulcer is non-healing, so in such a situation, management of blood glucose level is very important if it's a case of a diabetic ulcer. And last, if the patient is having pain due to the ulcer, so pain medication should be prescribed. Apart from this, if the last resort is surgery. So students and viewers, this was a very short discussion where I've simplified in simple terms what is the non-healing ulcer, the definition of an ulcer, the causes of non-healing ulcers, and the treatment methods as to how we can go for the treatment of a non-healing ulcer. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.